Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome to your channel The Anatomy Canvas. In today's class we are going to discuss with the bony features of the scapula, the side determination of the scapula and the muscles attached to it. So the scapula is one of the bone which is forming the posterolateral aspect of the chest wall. It has two surfaces, it has three borders, it has three angles and it has three processes. So first of all, the two surfaces, the anterior are the costal surface which is concave, and the posterior surface are the dorsal surface which is divided by the root of the spine of scapula into two parts. The upper part, which is the supraspinous fossa, is smaller, and the lower part, which is the infraspinous fossa, it is the larger and it is convex. Then the three borders and the three angles. So first of all, this is the superior border, which is a shorter border, and near the root of the coracoid process it has a notch which is called the suprascapular notch. Then it has the medial border and it has the lateral border. You can see this lateral border, this is the thick border, and its upper part it has a tubercle which is called the infraglenoid tubercle. These two fossa which are present on posterior aspect, the supraspinatus and infraspinatus fossa, they are attached, connected to each other through the spinoclenoid notch. Then the medial border of the scapula and the lateral border of the scapula. Now we will discuss the angles of the scapula. This is the superior angle of the scapula. This one is the inferior angle of the scapula, and this is the lateral angle of the scapula. At the lateral angle of the scapula, you can see this is the glenoidal cavity at which the capsule where the shoulder joint is attached, and this gives attachment to the humerus bones. Above the glenoidal cavity, you can see here is the supraglenoid tubercle, and below the glenoidal cavity you can see the infraglenoid tubercle. So this glenoidal cavity is little bit directed little bit anteriorly and forward. So this will be the position of the scapula. Now we will discuss the processes. The first of all, the spine of the scapula, then the acromion process, and then the coracoid process. So the spine of the scapula, it is a triangular plate of the bone. It has a posterior border, and this posterior border has two lips, the upper lip and the lower lip of the spine of the scapula. This spine of scapula continues as the acromion process. So by looking at the position of the scapula in human body, you can see this is the medial border of the acromion process, and this one is the lateral border of the acromion process. Similarly, this is the superior surface of acromion process, and here is the inferior surface of acromion process. Also, you can see this is the coracoid process, and this coracoid process is directed little bit laterally. So these are the bony features of the scapula. Now what about the side determination? This one is the model of the scapula, and these two bones are taken from the human body. These are the original bones. So first of all, you can see the anterior surface of the two bones. This is the bone of the right side, and this one is the bone of the right side, and this one is the bone of the left side. So this bone has anterior surface, the posterior surface, and then the medial border and lateral border, and here you can see the glenoid cavity, the acromion and the coracoid process. Similarly, you can see this bone, this is the anterior surface or the costal surface, the posterior surface or the dorsal surface, the spine of the scapula, the acromion process, the coracoid process, the glenoidal cavity, the lateral border and the medial border. So by placing both the bones in their anatomical position, you can say this one is the bone of the right side of the human body, and this one is the bone of the left side of the human body. So these are the bony features and the side determination of the scapula, and now we will discuss the muscles attachment of the scapula. Now we are going to discuss the different muscles attached to the scapula bone. This one is the anterior or the costal surface of the scapula, and here is the posterior or the dorsal surface of the scapula. So first we will see the attachment of different muscles on the costal surface. Here you can say this is the subscapular fossa and medial two-thirds of the subscapular fossa, giving origin to the subscapularis muscle. Now look at the medial border. This is the area from the superior angle to the area where the root of the spine arises. So this area give insertion to first digitation of the serratus anterior. Then next two digitation of the serratus anterior muscles are inserted along the medial border, and last five digitations of the serratus anterior muscles are inserted along the lower part and the inferior angle of the medial border. This area is the suprascapular notch along the root of the coracoid process at the superior border, and here the inferior belly of the omohyoid muscle is attached. This is the area where the coracoclavicular ligament is attached, and this is the coracoid process where you can say this is the insertion of the pectoralis minor muscle. Also you can say this is the tip of the coracoid process, and this tip of the coracoid process gives origin to two muscles. At the medial aspect the coracobrachialis muscle arises, and at the lateral aspect the short head of the biceps brachii arises, and the long head of the biceps brachii arises from the supraglenoid tubercle. So here you can see this is the area where long head of biceps brachii arises, and this is the area from where the short head of the biceps brachii arises. This is the area you can see the glenoid tubercle, and this green color area shows the line of attachment of the capsule of the shoulder joint. Here you can see along the lateral border, this is the infraglenoid tubercle, and here you can see the origin of the triceps muscles which arises from this infraglenoid tubercle. Now we move on to the posterior aspect or the dorsal aspect of the scapula, which we have discussed that it is divided into two fossae by the root of the spine of the scapula, the supraspinous fossa and the infraspinous fossa. So from the supraspinous fossa, from its medial two-third and also from superior surface of the spine of scapula, you can see this is the origin of the supraspinatus muscle. Similarly, from the medial aspect of the infraspinous fossa and along the inferior surface of the root of the spine, you can see there is the origin from the infraspinatus muscle. This is the crest of the spine and the acromion process. So you can see the trapezius muscle is inserted along the medial border and upper lip of the crest of the spine where trapezius is inserted. Similarly, the deltoid muscle take its origin from the lateral border of the acromion process along with the lower lip of the crest of the spine. So this is the origin of the deltoid muscle, and this is the insertion of the trapezius muscle. This one is the supraspinatus, and here is the infraspinatus. So now we move on to the medial border. From the superior angle to the root of the spine, this area gives insertion to levator scapulae muscle. At the area of the root of the spine, the rhomboides minor muscle is inserted, and from the root of the spine till the area at the inferior angle, you can see this is the area of insertion of the rhomboides major muscle. So now we move on to the medial lateral border on the dorsal surface. You can see this is the infraglenoid tubercle where the triceps brachii is attached. Then the teres minor muscle is attached by two digitation, and between these two slips the circumflex scapular artery passes, and from the lower part of the lateral border you can see this is the teres major muscle which is arising from here, and the some strips of the latissimus dorsi also takes origin from here. So these are the different muscles which are arising from the anterior and the posterior aspect, or the dorsal and the costal aspect of the scapula muscles. Again I revise: the supraspinatus, the infraspinatus muscle, the insertion of the trapezius muscle, the origin of the deltoid muscle. Here is the triceps brachii from the infraglenoid tubercle, the teres minor muscle, the teres major muscle. Here you can see the levator scapulae muscle, the rhomboides minor, the rhomboides major muscle. At the anterior aspect, you can see the subscapularis muscle, the different digitations of the serratus anterior muscle. Here you can see the pectoralis minor muscle, which is attached to coracoid process, and at the tip of the coracoid process you can see the origin of the coracobrachialis and short head of the biceps brachii, while long head of the biceps brachii taking origin from the supraglenoid tubercle. So here I complete my today's class. Thank you very much for your attention. Allah Hafiz.